Okay, this is a short video on different styles and types of stethoscopes. I want to go over the parts and pieces. I recommend that by the time you get to practicum, you purchase your own stethoscope, but to start out with, you don't need to. We have them here in the classroom. I recommend that here in the classroom, you try the different types and styles. And see what you like best. There's different earpieces and things we're gonna go over, etc. So we're gonna start down here at the base of the stethoscope. This is called the bell. There's kind of a covering here. This is called the diaphragm. This diaphragm takes the sound, amplifies it, and sends it up the tube of the stethoscope into your ears, okay? So there's a large side, which is typically used for adults, and then a smaller side. This side doesn't have a diaphragm, whereas this type of stethoscope does have a diaphragm. That covering on the small side, typically used for pediatrics or smaller areas. The other thing that's good to know about the bell of the stethoscope is if you see this, you can kind of hear it lock. That's how you turn it on and off, okay? So on the single tubes type stethoscopes, you just hear it lock and you got to give it a little tap and listen in your ears. And if you'll hear something, but if you don't hear it loud, then turn it the other way and give it a little tap. There's a very distinct difference if the stethoscope is on or off. This type over here where we have the dual tubes, where there's two tubes, this type is called a Sprague stethoscope. And again, these are the ones where you'll typically have a pediatric diaphragm. What I want to point out on these, it has a flat area on the bell. So see how it's rounded on this side and flat on this side? The Spragues have that. The flat side is what's on. So right now the adult side, so to speak, is on. And I can rotate this. And now the pediatric side is what's on and where I will hear the sound, okay? So if you're having trouble hearing a blood pressure, make sure your stethoscope is on. Turn it on and off and make sure you're getting the amplified end, okay? So again, that's the bell, adult side, pediatric side. Some have diaphragms on the ped side, some don't. You can still hear on this side. So just kind of some general information about the tubes and how to turn your bell on and off. Again, a tip if you're not hearing your blood pressure very good. So again, single tube, double tube is typically a Sprague type, and then we have the arms that reach into the ears, okay? So up here we have a couple of different types of earpieces. So you can see these are round and really kind of squishy. So again, try a couple different ones out in class and see what works for you before you spend money on them, okay? So some people like the single tube because the tubes don't rub together and cause extra noise. Some people like the double tube because they feel like they're getting twice as much sound, you know, a tube coming up to each ear. Again, just try what you like. So like I said, these earpieces are a little bit squishy and round. These earpieces are kind of flat, again, kind of soft for your ears. These earpieces are really hard, okay, and go right into your ears. And then these earpieces are the same as that. So most stethoscopes come with interchangeable earpieces and extra diaphragms to go on the bell of your stethoscope, okay? The last thing that I really want to show you on the stethoscope is if you take your stethoscope and when you go to put it in, you always want to have it at a little bit of an angle. See how those are angled just a little bit? And that angle should go forward. If you put your stethoscope in this way and the angle goes backwards, it just hits up against your bone and it doesn't go to your ear canal. So you're not going to hear anything or maybe just a little bit. So the angle needs to go forward in towards your ear canal and right into your ears nice and snug like that, okay? So sometimes they'll be like this one. See how there's not much of an angle to it? You can twist them. They're meant to be twisted like that. Then you have a nice little angle, okay? There are a few stethoscopes out there, some of the cheaper ones where you can't twist and they're straight back and forth. Not a big deal. It's just you're going to hear a little bit better if it's slightly angled forward towards your eyes, towards your nose, if you will, because that's how that ear canal kind of runs, okay? So again, just some tips for you to get the most out of your stethoscope and to hear blood pressures best.